Good morning, everyone. We know St. Jude Children's Research Hospital, one of the gems across Memphis and the Mid-South. We're so lucky to have them here. And this morning, we're talking about a surprising statistic. More than 35,000 men and women each year will be diagnosed with a cancer caused by HPV in the U.S. About 14 million people in the U.S., including teens, become infected with HPV each and every year. I'm joined now by Dr. Heather Brand, Director of HPV Cancer Prevention Program with St. Jude Children's Research Hospital. Dr. Brand, good morning to you. First off, can you tell our viewers what HPV is?
Sure. So HPV is human papillomavirus, commonly just referred to as HPV. And as you mentioned in your intro, HPV is very, very common in the United States. It's so common that almost everyone will have an HPV infection in their lifetime. What we don't know is in those people who have an HPV infection, how many of those will turn into cancer. And so this is why HPV vaccination is such an important cancer prevention tool. So we are focused on ensuring that all children are vaccinated against HPV so that they can prevent HPV cancers that they may develop in adulthood.
Do we know what causes HPV?
So HPV is a very common infection that's passed from one person to another during intimate contact. And this is part of normal human growth and development. And we want to protect our children from a lot of things, but unfortunately we can't maybe protect them from everything. And so this is where HPV vaccination comes into play. If we're able to protect 9 to 12-year-olds, which is on-time HPV vaccination, by the 13th birthday, we're going to prevent those HPV infections that may be acquired in their teenage or adult years and protect them well against HPV cancers they may develop in the future.
And do we know any drawbacks from this vaccine? I know that you're talking about having your child have the vaccine before their 13th birthday, right?
Yes, that is our priority here in the St. Jude HPV Cancer Prevention Program. We're focused on promoting on-time HPV vaccination. That's to make sure that children are protected before they might engage in behaviors where they would acquire an HPV infection. We also know that the vaccine works really well at this age group, that the immune response that comes from the vaccine is sufficient enough to protect them throughout their entire lifetime. So for those reasons, we're focused on the on-time population. In terms of drawbacks, we know that parents and caregivers who are making vaccine decisions for their children really want to make sure something is safe before they're going to give it to their child. And in the case of HPV vaccination, which has been around since 2006, so more than 17 years, more than 500 million doses of HPV vaccine have been given worldwide. And this vaccine has a really strong safety profile. It works really well also. We know that it can prevent actual cases of cancer. So it's safe, it works really well, and giving it on time affords a lifetime of protection against HPV cancers.
Why are some people, if it's so safe, why are some people kind of apprehensive? Is it because of, we're coming out of the pandemic and people are just overall apprehensive about vaccines in general?
That's a great question. So we know that parents and caregivers want to make sure something's safe, as I noted. We also know that during the pandemic, with some concerns about COVID-19 vaccines, maybe not working as well as they should, that some of that may be conflated to other routinely recommended vaccines like HPV vaccination. And so our job at St. Jude, or at least part of our job when it comes to HPV vaccination, is to help build and rebuild, in some cases, confidence in vaccinations. Vaccines have been a great public health marvel since their first introduction. They've led to the eradication of smallpox, polio, and saved millions of lives from vaccine-preventable diseases. And so parents and caregivers want to feel confident and make an informed decision when it comes to these vaccines that they're giving to their children. An HPV vaccine is very safe. It's routinely recommended. St. Jude joins the American Academy of Pediatrics and the American Cancer Society in strongly recommending this vaccine for this on-time 9 to 12-year-old age group. So we know that there are a lot of concerns. There's also a lot of myths and misconceptions that parents and caregivers may hear about or learn about. And so part of our job is also to take those on and provide accurate and trusted information that people come to St. Jude for that type of information.
Where can parents and others get some information on the HPV vaccine?
Well, we hope that they'll visit us online at stjude.org/HPV and stjude.org/bright-future. We have information to answer questions that parents and caregivers have, even more than I was able to address during our time together here, to make sure that when a healthcare provider recommends this vaccine, that they're ready to say yes or get remaining questions answered, because this really is an opportunity for parents and caregivers to protect their children against cancers. We all know people who have suffered, and my colleagues here at St. Jude work incredibly hard every day to save children's lives from cancers that we do not yet know how to prevent. But here we have a safe and effective vaccine that offers long-lasting protection against these HPV cancers that children may develop as adults.
Okay, Dr. Heather Brandt, Director of the HPV Cancer Prevention Program at St. Jude Children's Research Hospital. Appreciate the info this morning. Thank you for joining us.
Thank you so much.